Hello, everybody, and welcome to today's session. Women have shared vulnerable experiences of childbirth, which is now intensified during the pandemic. I would like to introduce to you to a friend and colleague who's chairing today's session, Dr. Kathryn Gutteridge, a long-standing consultant midwife in the United Kingdom. Kathryn has been involved in a tremendous work of supporting women following sexual abuse and developing pathways to support them in their pregnancies. So without much delay, I would like to invite you. So without any further delays, I would like now to invite Kathryn to chair the session. Thank you.
Good morning. My name is Kathryn Gutteridge and I'm delighted to be here to take part in this virtual conference, the very first of its kind for normal birth. The subject matter today, human and humane care, is an area that is very close to my heart. Childbirth and human care seems like a conflict in two paradigms, when in actual fact, when we listen to birth experiences, when we talk to midwives and when we talk to obstetricians, this comes up time and time again. So I'm delighted that this has found itself on the agenda for this conference. I'm also delighted by the speakers we have to give their take on understanding a little bit more about this subject matter, and we're going to explore it with these wonderful speakers. So during what has been a worldwide pandemic, the subject of humanity and how we as humans have experienced this virus and the way it's influenced healthcare, but particularly how it's influenced maternity care. There are many, many stories of women who have either found themselves to be in labour during a time when all that they had planned has changed, or indeed during an examination or a clinical assessment have found it to be in a less human way. So for instance, what we're doing at the moment is a virtual conference. There is not the usual human interactions and the touching and being with and the hugging that I know midwives do an awful lot. As a midwife, I've found it difficult and I've struggled to some degree with no interactions with other midwives or other healthcare professionals. And I know that midwives are very tactile and like to be with women. I mean, this very conference is virtual, and that has brought home to us how healthcare is being delivered, not in the traditional way that we would like, but actually virtual conference or virtual discussions with women of some very, very difficult scenarios that we know will stay with women throughout their lives. So I think that looking at this, being around, looking at this time will give us a great deal of research material, but also give us a great deal of deeper understanding in the ways that humans interact with each other and actually grow from being much more with the person in the moment. And as a midwife myself, I've known that some of the most satisfying times that I have had with women have been where I've just sat, I've watched, I've held their hand, and I've looked into their eyes as they know and I know that the moment of birth draws close. So I know that we will have a great deal to learn from this experience.